Hello, good day, good morning, good afternoon, good evening, good night. It will depend the time you are watching this video. Let me introduce myself. My name is Edgar Dario Ramirez de Leon. I am the founder and the CEO at Enable Systems, Reinventing the Future. Enable Systems is an enterprise located in Mexico, in the Jalisco state, and we are a totally legal, funded, accepted, validated enterprise by the organizations and the institutions here in Mexico. Of course, we have a website that is https://enable-systems.com.mx/en for the English language, because all our products are built in Spanish language. So if you enter not using the suffix /en, then you will see the site in Spanish. Of course, you can switch here between Spanish and English. That is the English, and that approach works for all our products and services. And well, which is the intention of this video? The main goal is to present you and to show you a little demo for the health services platform in its 001B for beta version, that I'm going to tell you a little more about this platform in a brief. So what else? Of course, you can, this is our email. At this moment we're having some details with our own domain, so we are using Gmail as email provider, and the email is enable.systems.mx@gmail.com, and this is our phone number. Remember that if you are that we are located in Mexico, so perhaps you have to use the Mexico prefix number. So that all that kind of data is also in our website, in the footer. Got it? So I'm going to close this. One thing that is important also, I really need glasses, but if I use it, then you can see the bright, and perhaps it's a little rude for you, I don't know, or it's even bothers you, so I have to take off my glasses. But it's perhaps that is something that in moments it will be a little difficult to me to read and things like that. But well, anyway, so this is the website for the health services platform, https://hs for health services.enable-systems.com.mx. Please note that this is temporal, because the Enable Systems will making payments to providers in order to turn it on and to be able and to be available the platform to show you this demo. And later perhaps we have to turn it off the servers in order to reduce our costs, because at this point nobody else is using this platform, and that is one intention of this video, to participate in crowdfunding campaigns in order to get resources to reduce costs for countries like Mexico, even, or countries in Latin America, for instance Colombia, Venezuela, Chile, Argentina, Brazil, I don't know, and so on, in order to use this kind of solution that I'm going to show you in a brief. So like I said before, this is temporal. At any point, if you want to use the platform, if you want to give a try, use it, or look how it works, please let us know. Send us an email, call us, or send us a text message, a WhatsApp message, whatever you want, in order to for us at Enable Systems, then we'll turn on the server. So what is health services? It's a platform that we believe that has a very easy to understand and very friendly user interface. We have a top bar, we have a main area, a footer, and a left panel that is collapsible. It will depend about the parent we are in the platform. When we have signed in, the left panel it will be other, as you said later. So what else? You can change between language, like I say, previously, Spanish, English. And left to the left of that button we have the About button. If you may click, it shows you the About dialog. At Enable Systems, we design and develop the Health Services 001B, remember the B is for beta version, platform with the aim of allowing the healthcare community, whether they are public or private healthcare centers, as well as doctors and other related professionals, to provide better service to patients. How and why do we think this? The platform integrates applications for the detection of diseases such as COVID-19, brain tumors, breast cancer, Alzheimer, diabetes, pneumonia, heart disease. Furthermore, offers services like creating new patients, storing data from the medical consultation, searching for medical consultation, as well as tracking the medical history of their patients. Health Services 001B integrates in its main dashboard graph statistics and records of the latest disease detection and patients. All of this is built on artificial intelligence technology, which is already a reality worldwide and is proving to be of great assistance and benefit to the humanity. Moreover, at the Enable System, we have decided to offer the platform and infrastructure costs, meaning all design and development is on us. That is, everything you are about to see related with user interface and related with the storing data and retrieving data and things like that. At the Enable System, we don't have any income for that, for everything you're about to see. So why? Because we want to give this kind of solution like to countries that perhaps they don't have the enough resources, not only human and perhaps mainly economical resources, in order to pay solutions like this. And we want to offer only at the infrastructure cost. This means that you will only cover the cost of the application, infrastructure, computer, operating system, and so on, which is beyond our reach and is provided by third parties like Amazon Web Services, AWS, or Google Cloud Computing. No small print, neither contrast. Why do we do this? To answer this question, let us go back to the origins and philosophy of Enable Systems. If there is something that makes us special or more unique and an Enable System, is our conception. The company was not conceived, nor is it among its top priorities to be profitable. I understand Edgar Ramirez, as the founder and the CEO and the main voice at the Enable System, that every company and even at personal level, we require money to survive. But we believe at the Enable Systems in research, development, innovation, and scientific and knowledge dissemination as a point of reference in Mexico and Latin America for the sustainable, responsible, and sustainable development of countries and regions. We understand that the context of each country, area, and region is different, even within the same country. We are aware of the realities that affect humanity, and for all the above reasons, we have decided to extend of our possibilities. Like I said before, we are conditioned by payments to suppliers, third parties that support our technological infrastructure, to offer this platform at very accessible cost, thinking about the needs of the communities. So, and this is the intention also for us to participate in this kind of crowdfunding campaigns, to get resources, to make some improvements, enhancement to the platforms in order to reduce the cost for the countries, the users, and they only preoccupate or just think about the infrastructure costs. Got it? Or perhaps even reduce even more the cost. It will depend on your support. If we can continue count with your support. So we invite you to read our terms of services and privacy policies. If you may click, you will be redirected to our website, main website, with the terms of services and the privacy policy. For more details and information regarding our legal, ethical, and data protection framework. So, last but not least, Health Services 001B, as well as all company products and services are provided as is, without any warranty of any kind. And that is a very common legend. It's not exclusive of Enable Systems. As far as I know, many or all companies related in this technology field say something like that, and for instance in our license agreements, because we don't have is provided as is without any warranty of any kind. So that is very important to let you know, and I must insist that it's not exclusive of Enable Systems. So I'm going to close this dialog, and then I'm going to show you the whole process from the very beginning. I mean the sign up process, the sign in and so on, how to create a new patient, create a new medical consultation, use the disease detection apps, and so on. So the first step is sign up. I'm going to use all the validations is already implemented. For instance, if you input an invalid email, the platform will let you know. So I'm going to use our email address. This field is also validated. That it means that it will only accept numbers. I'm going to use our phone number. That you can see also the format is the field is automatically formatted. Sorry. The password also is validated. Of course, you can switch between displayed or not displayed. The password I'm going to display it just in order. Look, the password requires at least 1 8 characters long, at least one uppercase, at least one numeral, and at least one symbol. I'm going to use a dummy password. Got it? Look, this is the kind, and all the message in our platform, it will appears in this way, and I mean centered at the bottom part. So of course it's also validated if the passwords don't matches. So I'm going to copy this, I'm going to paste, and if you may click and sign up, then to continue you must accept the terms of services and the privacy policy. All the validations, like I said before, is already working, and you can make click in terms of services, and remember that it will be redirected to our website. I have checked, mark as I have read, and then sign up. Account created and email verification is required. So this is a very natural step in many sites and many platforms. And then let me show you, because I have two monitors, then you receive an email like this. Enable System, please confirm your email. Hello, you or someone else has requested a user account in our health services 001B platform. If you made this request, then please confirm your email by click this link. If you did not make this request, then you can simply ignore this email. Best, Enable System reinvented the future, and this email was automatically sent from Enable Systems. Please do not reply. What happens if I try to sign in and not confirm my email address yet? Sign in. Please confirm your email address. What happens if I try to sign in with an invalid account, email or password invalid? Got it? Everything is already working at this point. Got it? So then I have to confirm my email address. Click, and then the email address verified. You can now sign in. I'm going to close this tab because this is Google Chrome. I'm going back to my Mozilla Firefox. That is where I am. So I'm going to sign in now using my password, my user account, and my email address. Sign in, and that is. This dialog says that validation data is required. What kind of validation data? The professional ID, because the platform is intended to be used by professionals, medical doctors,